Pharma, for giving me the opportunity to talk to you all today. Esteemed faculty, family physicians, emerging physicians and residents, Assalamu alaikum. On behalf of Pakistan Society of Internal Medicine, I welcome you all to this panel discussion, which is one of its kind. We are doing this program in collaboration with Vitamin Pharma, and we are very thankful to them for giving us the opportunity to disseminate knowledge to all the esteemed audience who are present over here. Ladies and gentlemen, Takat ka tika. You must have heard it numerous times from the patients. It also बहुत कमजोरी है ताकत का tika. So today we will be unfolding the mystery of this takat ka tika. And let's find out what scientific evidence we have for this takat ka tika. My name is Dr.Somia Iqtadar. I am the Associate Professor of Medicine at Indian Medical University. I have been given the responsibility to serve as the Secretary General for Pakistan Society. So, ladies and gentlemen, we will be talking about the indispensable role of vitamin B12 in various medical conditions. So, before I start on by telling you what is the role of this particular vitamin in different medical conditions, let me take back to the medical school. The medical school in which we heard about different types of vitamins. So let's find out what are the basics about vitamin B12. There are two kinds of vitamins, water-soluble vitamins and fat-soluble vitamins. So we know that water-soluble vitamins are vitamin B and C, and the A, D, E, and K are the fat-soluble vitamins. So vitamin B12 is actually a water-soluble vitamin which is present in the natural food that we take every day in the form of poultry, fish, meat, and eggs. It is also present in milk and dairy products and fortified cereals, which are a good and a rich source because they are fortified with vitamin B12.
So the vitamin B is usually required in our body for maintaining the normal function of the body, which involves the maturation of the red blood cells, neurological function, and protein synthesis, and so many more functions are associated with it. The types of vitamin B12, they can be in the inactive form or active form. In the inactive form, we have cyanocobalamin or hydroxycobalamin. But in the active form, it is present either as adenosylcobalamin or methylcobalamin, which are the forms that we use in our daily practice. Now, how is vitamin B12 absorbed in our body? So there are three-step mechanism actually. There is an R factor which originates from the saliva, followed by the intrinsic factor, which is secreted by the parietal cells of the stomach. In the presence of intrinsic factor, about 10% of our vitamin B12 is absorbed. And then in the acidic environment of the stomach, this is absorbed. And then the pancreatic enzymes in the ileum, they also play a role in the absorption of vitamin B12. So people who lack intrinsic factor, they have a decreased ability to absorb vitamin B12. And this results in about 80 to 100% excretion of oral doses in the feces versus 30 to 60% excretion in feces as seen in individuals with adequate intrinsic factor. If we talk about the recommended dietary allowances for vitamin B12, that from birth to 6 months, there is a requirement of about 0.4 microgram both in males and females. As you grow older, the requirement increases. And in the adolescents, the requirement further increases. And in 14 plus years, we require about 2.4 micrograms of vitamin B12 in our daily food intake. But when there is a state, which is a physiological state, like pregnancy or lactation, there's slightly increased requirement of this vitamin, making it to about 2.6 micrograms. What happens now if this vitamin is deficient? So the vitamin B12 deficiency can be due to malabsorption syndromes, which can be because of lack of intrinsic factor or parietal cells. It could be due to atrophic gastritis. In patients who've had gastrectomy, they have less absorption of vitamin B12 because of part of the stomach has been removed. And if ileum has been removed, that also leads to low absorption of vitamin B12. Then there could be nutritional deficiency, especially people who are very elderly, only on vegan diet, or people who use alcohol. They have inadequate intake of overall food components, including the vitamin B12. Then there could be drug-induced suppression of vitamin B12 absorption. And this is more prominent in patients who are diabetic because use of metformin is associated with decreased absorption of vitamin B12. And another drug which is very commonly prescribed to all the general population of patients who are consulting physicians is the proton pump inhibitors. So prolonged use of proton pump inhibitors, H2 receptor antagonists, and antacids, they also lead to decreased absorption of vitamin B12, leading to its deficiency. Now the question arises, how do we diagnose vitamin B12 deficiency? So diagnosis is very simple, and it is based on the low serum vitamin B12 levels, and a level of less than 200 picograms per ml is considered to be abnormal or low vitamin B12. Previously, you must have heard about Schilling test in your old textbooks, but it is no longer used for the diagnosis of vitamin B because of its low awareness. It's not readily available, it's costly, and it is difficult to perform because it is a two-step process. So it is not routinely used for the diagnosis now, and diagnosis is made on the measurement of the vitamin B12 levels in the blood. Another test which we can help in assessing the vitamin B12 deficiency are the homocysteine levels. The homocysteine levels are a sensitive method of screening the vitamin B12 deficiency because they are an early marker of B12 deficiency if they are raised. So a raised homocysteine levels should have raised an alarm that probably this patient might be vitamin B12 deficient. Now there is a long list of diseases which are associated with vitamin B12 deficiency. And it has been, as I said in the beginning, ताकत का टीका या ताकत की गोली से इसको associate किया जाता है because it has been very rightfully reputed as the energy vitamin. And by supporting numerous processes which are crucial for energy production, it can positively influence the energy levels and improve the body's performance. And subsequently, if there is deficient vitamin B12, then we have this energy crisis going on in the body. So there are a number of neurological problems, hematological problems, gastroenterological problems, metabolic problems which are associated with vitamin B12 deficiency. For example, if I talk about peripheral neuropathy and dorsopathy, they have been associated with vitamin B12 deficiency, be it the carpal tunnel syndrome, wrist drop, or Bell's palsy, which is a cranial nerve palsy. They've all been associated with decreased levels of vitamin B12. And to further strengthen my argument, I'm sharing with you this journal which has reported that the intramuscular vitamin B12 injections appears to be of benefit in reduction of chronic low back pain and improves the disability. So in vitamin B12 deficient patients, if we replace the B12, then there is a functional improvement in the patient. Then there has been a lot of debate going on by the use of vitamin B12 in the diabetic population. Or for some reason or another, we make sure that patients who are diabetic, and specifically those who have neuropathic symptoms, we add on a B12 tablet to their prescription. Doctors are also questioned by patients many times to add on an injectable form of B12 to them, thereby reporting that we feel better when we get injectable vitamin B12. So the argument is supported by the scientific evidence that the vitamin B12 is involved both in methyl malonyl-CoA mutase and methionine synthase intracellular pathway. And the vitamin B12 deficiency interferes with the two pathways and then causes the increased level of methyl malonic acid and homocysteine, which are considered as the biochemical indicators of cellular vitamin B deficiency. So it has been studied vastly in the literature that association of B12 deficiency, especially in patients who are diabetic, with and without metformin, if we compare them, then we have seen that patients who have been using managing their diabetes with metformin, they have decreased level of B12, and replacing these B12 levels, we can improve the overall somatic and autonomic symptoms of the patients. Talking about gastritis, GERD, and PPI-induced B12 deficiency, we know that H. pylori infection is a very common diagnosis in the gastro clinics, and the incidence of H. pylori infection is very high in the Southeast Asia and particularly in Pakistan, where it has been reported as high as 81%. And the literature has shown that proton pump inhibitors and risk of vitamin and mineral deficiency is now an emerging health concern, and PPIs have been associated with an increased risk of vitamin and mineral deficiencies impacting the vitamin B12 levels as well. When we talk about anemia specifically, in megaloblastic anemia, we know that the anemia of megaloblastic type is associated with B12 and folic acid deficiency. So B12 patients have deficiency not only of hemoglobin, iron, high blood homocysteine level, and high MCV, which make it a point that this is one of the causes of pernicious anemia. The main cause of B12 deficiency that results in megaloblastic anemia has been documented as pernicious anemia, which is actually caused by the autoimmune destruction of gastric parietal cells. Coming on to the treatment options, what we have to correct this. So the treatment options are in the form of replacement of vitamin B12, which can be in the form of oral replacement or IV replacement. So cyanocobalamin and methylcobalamin are the supplementations which can help us in addressing this problem. So the dose regime that we take is, the literature shows, this is published in the current therapeutic research journal, that there is an overall improvement if we supplement the patients either with oral or IV methylcobalamin. And there is about 66.6% in the injectable group and 39.1% in the oral group. Coming on to the dosage of this supplementation, the oral administration has to be 500 micrograms of mecobalamin 3 times a day for a period of at least 8 weeks, that is 2 months. And for IV administration, same 500 micrograms per day, 3 times a week for 4 weeks, followed by 3 times a week oral 500 microgram mecobalamin for at least 4 weeks. And this leads to a remarkable improvement, not only in B12 levels, but overall functioning of the body. So with that, ladies and gentlemen, I thank you all for listening to these basic facts about vitamin B12.